freedom is just another word for the Medicare for the Lazy Man podcast. A podcast that proudly flies the flag every day. Once again, Medicare experts agree he is Medicare expert Doug Jones.
Well, hi there, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. This is your Medicare expert for today, Doug Jones. I'm hoping to be your Medicare expert far into the future. And the reason for that is because I just love helping people understand Medicare and feeling more confident about their ability to encounter Medicare and come out the winner. Everybody has the capability, but some people don't understand that. And my job is to help people understand Medicare to the extent that it needs to be understood and to make the decisions necessary going into Medicare so that you never have a regret on the other end. And I do that by means of my book, Medicare for the Lazy Man. Currently, the 2024 edition is the one that's you're going to find in the bookstores. By bookstores, I mean online at barnesandnoble.com or amazon.com. If you go to the search window at either of those websites and type in Medicare for the Lazy Man, the 2024 edition is the most current one. I'm working feverishly on the 2025 edition. It'll be available before you know it. But in the meantime, what you do with that 2024 edition is, first of all, if you're at Amazon, you have to decide which of the four options you want to purchase. You have your choice of a paperback version. You have your choice of an audible version wherein somebody will actually read the book to you. You don't have to do any work. Just lay back and let that knowledge wash over your brain. You might want to download the $4.80 version. It's the Kindle version. If you've got a reader that Amazon supports, they'll just send it right to your reader, and it'll be like instant satisfaction. And then, of course, for gift-giving purposes, I've created the $24 hardcover version of Medicare for the Lazy Man 2024. Important to note, this book will be changing to 2025 at some point in the future, but that doesn't mean that you shouldn't buy it now if you have an immediate need for Medicare knowledge. It will make you a Medicare expert unlike any of your friends and family and neighbors. The 2025 edition has been tweaked and tuned to meet the changing times, but the 2024 edition stands on its own as an excellent tool for those who are approaching Medicare. Speaking of tools, oh no, I didn't mean to call Randy a tool. He's my buddy. Hello, Randy. Sorry about that inadvertent error there.
Oh, that's funny. I haven't heard that expression for a long time, but it used to be pretty popular.
It did, but then we got old and stopped using it, so it's
Yes,
a
yes.
blast from the past now.
So how are you today?
Well,
Bottom line is, I'm looking at the temperatures. The temperatures are good. The oil pressure in my computer is doing fine. How
well,
about you?
that's always a big concern. Well, I pulled the dipstick out not long ago, and it's right up to the line. So I don't think I need to add anything, but it's important to keep those fluid levels in the proper locations.
So now here, this is a true story. You know how I'm always full of stories.
Well, yeah, you're full of a lot of stuff that is.
Well, that's true. That too. Way back in the day, in the early days of mainframe computers, disk drives, the access arms,
Okay.
were actually hydraulic. So the worst thing that could ever happen is once in a while the disk drives would blow a hose and it would blow hydraulic oil all over your computer room.
That's incredible. They were hydraulic, and they
Way
had
back in the day.
what kind of fluid did they use?
Just basically it was brake fluid, basically.
Oh, okay. Oh man. Well, I'm glad they managed to put those out to pasture, because frankly, who wants a a bunch of strange fluid in your house and your laptop computer. Of course, I don't even have a disc reader in my or CD reader or anything in my latest version of my laptop. You have to buy that separately. I guess it's got so much power and capacity packed into it that there's no room in there for a CD reader.
Either that or they just don't want to give you one so they can cut the price.
Well, they cut the price and then they added on when I ordered one anyway. Where's my CD slot? Well, you don't get one unless you buy it separately.
Back in the day, you used to get that included.
Yeah, I sure did. I've got some older computers around here that have all those bells and whistles. And my new one, I've loved very much, but, it's got fingerprints all over it. And if I can't convince anybody to clean up my computer, the only solution I can come to is to get a new one.
That's funny. Way back in the day, I used to laugh. I used to tell my dad, I bought new tires for I drove a goat GTO,
Right.
I used to buy new tires for my goat all the time. And he goes,
well, you
"What's the matter
probably
with the
needed them.
Well, there was that problem. And he goes, "What are you buying new tires for?" And I said, "Well, I need new tires." And he says, "What? As soon as you have to check the air in them, you buy new tires? What the hell?"
Oh, yeah. Well, that hits a little too close to home. We used to have a guy that traveled with us in our traveling Corvette group, and he paid extra at his tire joint to have nitrogen put in his tires, which I thought was incredibly dopey because it cost a lot of money. And he was a Canadian, so it cost a whole bunch of Canadian loonies and toonies for him to do that. And the whole point was that theoretically the nitrogen molecules were larger and they wouldn't seep out through the minute apertures.
And plus, the guy back at the gas station was laughing all the way to the bank with his $50 for nitrogen that he filtered out of the air with this little thing that looked pretty much like a
compressor.
Top of a coffee perker,
Yeah. Well, I'm pretty sure it was not 50 loonies and toonies. It was more like 70 in Canadian, 50 American. But he was very proud of himself. He every mile he drove, he said, "I'm getting my money's worth out of that nitrogen." I believe he was wasting his loonies and toonies, but that's
that was back in the day when that was a big thing, nitrogen for your tires. That's been quite a while ago, and then all of a sudden, just one day, everybody decided, all the gas stations that I used to frequent, I looked around and there was no more nitrogen machine.
Yeah.
And I said, "Well, what happened to your nitrogen machine?" "Nothing. Don't worry about it."
Well, I never saw a nitrogen machine, and I'm not sure this guy did either. I don't think he really had nitrogen in the tires, but he paid for nitrogen. So,
yeah.
The
only place I really want my nitrogen, Guinness.
Ooh, is that infused with nitrogen?
Yeah, same stuff.
Wow. Well, it's going to do you more good there than it would in your tires. That's for damn sure.
It will. It absolutely will. So, I have a job I need to do.
Yes, and your job has changed significantly from the prior episodes. You have to help me select the article about Medicare Advantage that we're going to be addressing in today's Medicare Advantage Minute. And you've got to do it not with numbers as you've been doing for maybe a couple of years now, but with letters of the alphabet. I hope that doesn't throw you for a loop.
I believe that the one I'm going to go with is U.
The tension is dripping from the air. Oh, not me.
U.
You mean letter U. Okay.
The letter U.
I thought you were telling me it was my fault that your life was...
T.
Okay,
U. V. U.
Got it. So I'm going to cross out U so that we don't accidentally look for it again in the future.
This is the reason we don't use letters, Doug.
I didn't. I thought you were accusing me of something. T-U.
I'm teasing.
We may go back to the traditional number system.
I should have said U like umbrella, like we used to in the military.
Well, speak for yourself, sir. I was in Air Force ROTC, and that's as close as I got to the military. Okay, this is another one that's multi-page. It's incredible to me that out of all of these one-page articles. You found two in a row that were actually longer than average. So here's the headline. I think this is a fantastic article. Insurers face backlash in the wake of the United Health attack. So let's see what this is all about. Insurers are facing a wave of public scrutiny and vitriol in the wake of the killing of the United Healthcare CEO, Brian Thompson. Mr. Thompson was fatally shot December 4th, 2024, outside of a New York Hilton in Midtown Manhattan, where the United Health Group was hosting its annual Investor Day conference. New York City police called the shooting a brazen and targeted attack. And as of December 6th, the subject was still at large. But no, we know now that it was a guy named Luigi Mangione, who is not Italian, by the way, or at least he's not, he's a Native American, I believe. The killing of the CEO of the nation's largest health insurance company has sparked a firestorm of online hostility towards insurers more broadly. Individuals took to social media to share their experiences with delayed and denied care by United Healthcare and other insurers, according to the New York Times. Some shared morbid glee over Mr. Thompson's death. And Randy and I called those people left-wing nuts. And then, of course, I heard from a guy who was an acquaintance, a longtime client, an acquaintance of mine, who objected to us calling those people left-wing nuts. And he said, how do you know they're left-wing nuts? Well, I think it speaks for itself. In any event, back to the article, despite the callous reaction from some people online, United Health Group said it received an outpouring of kindness and support after the attack. Authorities have not determined a motive in Thompson's killing. This is, of course, shortly after the killing. NBC News reported that the words deny, defend, and depose were written on shell casings found at the crime scene. The words could be linked to insurers' claim denial practices: delay, deny, defend. And Randy's got some similar acronyms. Why insurance companies don't pay claims and what you can do about it is the title of a 2010 book, critical of the industry, according to the New York Times. So that's Delay, the name of this book, if you want to get it for yourself. Delay, Deny, and Defend. Why insurance companies don't pay claims and what you can do about it. That's a 2010 book. So this problem has been simmering for 15 years. So following Mr. Thompson's killing and the heightened scrutiny of the industry, insurers are tightening security around their executives. A company called Centene, which is a very large company, canceled its in-person investor conference scheduled for December 12th in response to the attack. The presentation will be hosted on the same day, but it'll be hosted virtually. Medica closed its offices through December 13th out of an abundance of caution in the wake of the shooting, said the Minnesota Star-Tribune. Now, that's Medica, and I don't know that it's in the same location. The nonprofit regional insurer is based in Minnetonka, Minnesota, where United Healthcare is also based. We considered the workplace safety of our employees in making that decision. United Healthcare Group removed information, including headshots and bios, on its executives from its website following the attack. And that's theoretically to make future assassins have more difficulty in identifying and stalking and killing other company executives. Well, I'll tell you something. United Health is a company that's huge, and it is well known for being for riding the edge of what is normally considered to be prudent business practices, and they are really, they've built a huge market by being, oh boy, how can I say this? By being the cheapest in town in many cases. And when you're the cheapest in town, sometimes you cut corners that cause less than satisfactory customer service. And I think what we're seeing here is a reaction to the fact that many of their clients are not happy. But who makes the decisions with many of the people that are clients of United Healthcare that have their health insurance, it would be their employers. So when a company decides to purchase a group health insurance plan for its employees, they don't want to pay through the nose. They want to get something that's a lot of bang for the buck. One way to do that is to go to a company like United Healthcare that undercuts the marketplace when the clients are signed up as employees and participants in the new health insurance plan. They might start finding drawbacks in the employer's choice of health insurance companies. And that's just one of the bad things that can happen, and it causes anger because there's nothing your average employee can do about it. So that's that ill will is now spreading to other members of the insurance industry, and some of it's deserved and some of it's not. We've talked a lot about Medicare Advantage plans, and this is the Medicare Advantage Minute segment of our podcast, and it's a cautionary tale for those who are approaching Medicare and who have a choice between Medicare Advantage and Medicare Supplement. I always recommend Medicare Advantage, Medicare Supplement. Geez, I said it backwards. Medicare Supplement's the way to go if you want to avoid the potential problems that Medicare Advantage plans often present to their clientele. And another problem that we have in the podcasting industry is the imposition of sponsors. On the other hand, we love our sponsors because they provide some needed revenue for our Christmas party every year. So I think what we should do is listen to what they have to say. So we'll be back shortly. All righty. Well, after the Medicare Advantage Minute, we have a lighter activity, which we don't really call it anything. We refer to items that are listed alphabetically in Your Medicare Benefits, which is a government publication listing all of the stuff that Medicare might pay for. And if you have a medically necessary need for this stuff, then Medicare is probably going to pay for it for you. The item that we're going to talk about today, because we're still in the C's, it's all alphabetical, is Community Health Integration Services. I don't know what those are, but after I read this, we'll probably all know together. If your doctor or other healthcare provider gives you a social, if your doctor or other healthcare provider gives you a social determinants, they needed a proofreader. This is not well written. If they give you a social determinants of health risk assessment, they may find that social factors like limited access to food or your living environment are impacting your health or access to care. In these cases, Part B, as in Bravo, of Medicare covers community health integration services to address your needs and to help your healthcare provider diagnose or treat your medical conditions. Some community health integration services include, and here's a list, an assessment to better understand your life story, care coordination, health education, patient self-advocacy training, health system navigation, social and emotional support. Sounds like a bunch of pap to me. But anyway, you must have an initial office visit with your provider, which is separate from your yearly wellness visit. And then after that, you can start getting community health integration services. Sounds like fun. After your initial visit, you can get these services monthly. Your provider or their staff can give you the community health integration services, or they can refer you to other trained personnel, including community health workers, for the services. As for the costs, after you meet the Part B, as in Bravo deductible, which is $257 this year, you pay 20% of the Medicare approved amount. Now, that's implying that you don't have a Medicare supplement. If you've gotten a Medicare supplement, then that Medicare supplement may pay the 20% for you. If you get the Medicare supplement that I recommend, the high deductible Plan G, you're going to start the year paying 20% for some services. But if you, in fact, have a really bad year of medical expenses, you're not going to have to pay 20% of very much at all. You're going to be up to that 100% benefit level in no time flat. So for more information, you may go to medicare.gov/community-health-integration-services. And next time, we're going to be examining concierge care. Now, my idea of concierge care is when I snap my fingers and my doctor jumps. He might ask how high first, but concierge may not be what I think it is. It's going to be interesting to find out how close I am to the truth. And now we're down to the stack of articles I've been saving up just in case we run out of things to talk about, but we never do. One of those articles floated to the surface, and it's the one thing that's bothersome to me about our new administration and the dust they're churning up. It's the headline of this article is "Healthcare Industry Braces for RFK Jr." I'm not quite sure what to think about RFK Jr. I'm not 100% sold that he is what we need, but he's apparently going to be in charge of Health and Human Services, which is the giant government department that will oversee all of our health insurance plans. So Kennedy's views on vaccines in particular are causing alarm among some physicians and investors. Now, this was published just shortly after the election, 2 weeks after the election. So it was November of 2024. I'm sure that maybe things have solidified or maybe not, because on this day of recording, we're in late February of 2025. President-elect Donald Trump's decision to nominate vaccine skeptic Robert F. Kennedy Jr. to lead the HHS caused a stir last week, with some politicians and industry groups applauding Kennedy's anti-establishment ideas, while others worried that his leadership could send the nation backward on public health. Kennedy has espoused a number of controversial views about healthcare in recent years, including that Wi-Fi causes cancer, that the Food and Drug Administration is waging war on public health, and that AIDS may not be caused by HIV. If confirmed, Kennedy will oversee an 80,000-strong department, including the FDA and Centers for Medicare and Medicaid Services, which provides insurance coverage to more than 160 million people. Trump has promised to let Kennedy have free rein over health care policy. Although Kennedy hasn't laid out his agenda yet, he has expressed interest in curbing the influence of drug makers, promoting alternative medicine, and cutting the number of medical experts working inside the government. What we don't really need at HHS is more medical expertise. What we need in the government is an expertise on decoupling the agency from institutional corruption. Now I'm skipping down to a segment of the article entitled "All Eyes on Vaccines." Although Kennedy has said he is not anti-vaccine, his track record suggests a deep skepticism of them. Kennedy wrote a now retracted article linking vaccines to autism in 2005, and he made controversial statements about vaccines during the COVID panic. He also promoted a book on X that claimed COVID vaccines contributed to a mass of sudden deaths and insisted that most vaccines had been inadequately tested and that children did not need them. Kennedy's nomination is being cheered by groups that oppose vaccination requirements, including Citizens Council for Health Freedom. And they come as polio and measles cases are rising for the first time in years. I don't know if that's true or not. We expect to see more truth, fewer bureaucrats, and hopefully in combination with the new Department of Government Efficiency, DOGE, less wasteful use of taxpayer dollars for political pet projects that violate the patient, parent, and privacy rights of citizens. Other health industry groups, including the American Public Health Association and the American Academy of Pediatrics, decried the nomination. The head of the FDA's vaccination program is simply asking that Kennedy keep an open mind about vaccines. That seems like a reasonable request. Bracing for impact. Kennedy is likely to face scrutiny during his confirmation hearing. Already, Democrats have said they will attempt to block the nomination. Democrats will not be able to block Kennedy alone because of their lack of congressional control. However, they may be able to build a cross-aisle coalition due to the severe nature of some of Kennedy's beliefs, according to Jerome Adams, who served as U.S. Surgeon General during the first Trump administration. Bill Cassidy of Louisiana said they're eager to learn more about Kennedy's ideas. RFK Jr. has championed issues like healthy foods, the need for greater transparency in our public health infrastructure, said Cassidy. I look forward to learning more about his other policy positions and how they will support a conservative, pro-American agenda. Should Kennedy be appointed, analysts predict that the HHS, the Health and Human Services, could see a change of tone towards pharma advancement, particularly for popular weight loss drugs. Kennedy has previously suggested that patients taking those drugs, like GLP-1s, like Ozempic for weight loss, should instead transition to diets of healthy food. Stock for Novo Nordisk, which makes Ozempic, fell 4% between Kennedy's nomination and the day of this article being published. Despite Kennedy's lofty goals for reform, some experts expect that the end of the day, Kennedy will have a limited impact on healthcare day to day. I can't think of any examples of a cabinet secretary who went in and just decided to change everything, and everything changed overnight. That's sort of the antithesis of how government works, said Hal Andrews, president and CEO of Trilliant Health, a healthcare analytics firm. Well, Hal, I don't know if you're right or not, but my biggest concern is that the administration is in favor of Medicare Advantage plans, and I think that's going to be a real sticking point for me. Randy's giving me the secret signal that nobody but he and I know for let's play commercials, but we already played commercials. Our sponsors had their say, and didn't you hear the clinking of the money into our piggy bank?
Is that what that was?
That's for our Christmas fund, our Christmas party fund.
Okay, I got it. I was trying to get a second round of clinking.
Well, there may become a time when we can actually count on sponsors taking up the whole 30 minutes or whatever we do. And in that case, we're going to be so busy counting the cash that comes rolling in, we won't really have time to do much else.
That sounds like a plan. Let's go for it.
Yeah, I say let's execute that plan right away. Okay, let me find something short here because we're running out of time. This is a little thing about, no, it's not little enough. Let me keep searching here. We've got so much information and so little time. Here's a little article I've been looking at for a long time. I want to get rid of it. There is too much Medicare marketing. The headline on this article says, with open enrollment in full swing, and I think this was done last year. So when they call open enrollment, it's really AEP, annual election period, and it takes place from mid-October to early December every year. And so this article is complaining about too much Medicare marketing. And it starts out again, with open enrollment in full swing, older adults cannot escape Medicare marketing, pushing them to sign up for private plans. Nearly all responding to a recent survey had been exposed to ads, some of which are considered fraud. Medicare's open enrollment season brings television commercials, junk mail, and other forms of Medicare marketing of private insurance. They sure use the word private insurance. I sell Medicare supplements, and that's private insurance as well, but that's good, benign private insurance. Medicare Advantage plans are not good. Anyway, so those are insurance options that can overwhelm and mislead older adults into choosing plans that do not work for them. In Iowa, for example, a beneficiary called a phone number from a TV commercial he saw advertising Medicare Advantage plans. The representative who answered persuaded the man to enroll in a plan that was not available in his county. The following week, the beneficiary discovered his prescriptions were not covered by his new policy, and he was required to pay out of pocket. This incident was recounted by Iowa's State Health Insurance Assistance Program to warn residents to be wary of misleading marketing by Medicare Advantage plans, which are private insurance plans offered in place of traditional government-administered Medicare. Under rules for the Centers for Medicare and Medicaid Services, marketers may not call beneficiaries unless they agree to be contacted or have requested the call, and brokers and agents cannot coerce or otherwise pressure beneficiaries, that's participants, Medicare participants, into signing up for a plan. But unsolicited calls and emails from the plans themselves or plan representatives were commonly reported in the survey, meaning they're not following the rules. 74% reported receiving unsolicited calls from a plan representative. The main reason for all the marketing is the money made by private insurers. There they go, using the word private in a pejorative way. Just over half of Medicare beneficiaries are enrolled in Medicare Advantage plans, with under half choosing traditional Medicare. Medicare Advantage can control its cost by limiting beneficiaries to in-network providers, and the plans have been accused of overcharging taxpayers. A recent report from an advocacy group Medicare Advantage overcharges taxpayers by a minimum of 22%, or $88 billion per year, and potentially by up to 35%, or $140 billion. By comparison, the premiums for Part B of Medicare in 2022 totaled approximately $131 billion. The Commonwealth Fund noted that in 2022, the average Medicare beneficiary had more than 40 Medicare Advantage plans available to him, another 60 drug plans, and many Medicare supplement plans from which to choose. This heavy competition may represent an oversaturated market, with 96% responding to the survey saying that when they have too many plan options, they're more likely to stick to their current plan. So that's the story behind the headline. There is too much Medicare marketing. I think there's too much truthful Medicare marketing, or untruthful. There is a need for more truthful Medicare marketing, and that's what I'm trying to do every day. That's what I am employed to do. My Medicare for the Lazy Man is among the most truthful of all advertising about Medicare. It's not really advertising, it's storytelling, I suppose. And you can rely on the information that I provide, and especially the information I hope to use to keep people from selecting Medicare Advantage plans. And I'm hoping to select a lower altitude from Randy's placement today. So let's see what he has in store for me.
You're going to love it. You are absolutely going to love it. I'm going to put you in at an altitude that will make you happy. But before we do choose that altitude, there's a few things I always wanted to do before we sign off. One is to give you Doug's email address so you can reach out, dbj@mlmmailbag.com. Doug is licensed nationwide to help you with your Medicare supplement planning. Check us out at the website, medicareforthelazyman.com. We would appreciate it if you could drop a review for us in your wanderings through the internet. Even though we're early in the year, the bean counters are at it, so we need to keep up. Last but certainly not least, thank you so much for joining us. You could have been anywhere doing anything else, and you weren't. You were with us listening to Medicare for the Lazy Man podcast, which is exactly where we like to have you. But if you weren't checking your watch, here it is. You have just spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy from Oklahoma originally. No more, he's up in the high ground behind Cave Creek, Arizona, in the Nosebleed Mountains. But I'm going to take it easy on him today. I'm going to put him down at 6,400 feet.
Wow, that's a breath of fresh air. Thank you, Randy. And thank you, ladies and gentlemen, for joining us today. I'm sure hoping that you will come back to join us again for our next episode. We'll be looking forward to that. Bye-bye.